Helen Hays was born in Townsend, Cornwall on March 9, 1933, to Charles Hagenbach, a physician, and his wife Dorothy, whose maiden name was Brown.
I do remember the gardens mainly. I mean, we ran wild and we were never hungry at meals because we would go and scavenge around the gardens, which were beautifully kept up, had delicious carrots when you pull them straight out of the ground.
Helen was the middle child, with an older brother, Paul, and a younger sister, Frida.
We all had handkerchiefs in those days, and Paul would get out his big white handkerchief and scrape all the dirt off the carrot and then eat it.
Life was idyllic at the family's country house, Buckshead. Then, when Helen was just 6, her mother took ill.
We were playing in the garden. It was a chilly day. It was April. She came out of the house and scolded us for making so much noise. And she'd never done that before. There's a complete change of character. Anyway, it was the beginning of meningitis, which killed her. Of course, no antibiotics in 1939.
The children weren't told what had happened to their mom.
Whenever we asked, oh, she's gone away to get better. And the servants, of course, weren't allowed to say anything that she died or anything like that. One day, a driver came to drive her car around. I was in the back seat and Grandma Hagenbach. We got to the driveway of the little girl's house where I was going to play with her during the morning. Grandma opened the car door and said, "Your mother's not coming back, she's dead." And then she opened the door and left me standing on the roadside to go up quite a long driveway to the house. And I remember that indelibly. And Paul was the same. He was asked if he wanted to go to the funeral, but he didn't answer right away. He probably didn't know what they were talking about. And when the time came, they went to the funeral and he didn't.
After their mother's death, the 3 kids were left on their own.
So we'd go off walking, going for miles. And we quite enjoyed it, actually. It was nice. We had been given a sandwich to eat and some stale cake. And we thought it'd be nice to eat it. So we went on the field side and ate our sandwiches and things. And then we started thinking it was pretty darn funny. And that if anyone saw us, they wouldn't realize that we were the doctor's children. That would have been disgraceful. We got the crumbs of the cake in our mouths and blew them at each other. It was disgusting. We were shrieking with laughter. And then something made me look up, and there was a woman looking down at what we were doing. And Free and I just and behaved ourselves after that.
Charles sent Helen away to stay with relatives as he struggled to work and bring up 3 children.
Paul was adored because he was the son, and Frida was a beautiful child. She's beautiful all her life. She's gorgeous. People loved to have her on their knees. She sat there and sucked her thumb, and she was gorgeous. And I was the scamp. So I got sent to various relatives. I ended up at Granny Brown's on the farm. My father said to me he'd got a surprise for me, and he knew I'd like it. And I couldn't guess. And then he finally said, "You have a new mother." And he told me that my new mother would be coming and join us in the car. I looked at all the women that were passing by on the street and wondering if this one would be my new mother or that one. And then this tall, plump woman appeared, and I said to myself, I hope it's not that one. But it was that one. She was a really evil stepmother. She was very unkind to us.
Charles and Barbara May had a daughter, BJ, and the family moved to a medical clinic at Coombe Down, where Bath stone was mined to clad the walls of the famous city.
Coombe Down is a very interesting village. It's an industrial effort. They had discovered the beauty of Bath stone and how easy it was to work with it. They hollowed out the ground actually underneath where they put the village. Coombe Down was a nice place, but we would see other children and they didn't want to play with us. In fact, it was a group of kids and I went over to say hello and they threw stones at us, which was very unpleasant.
In the latter stages of the Battle of Britain, Bath was hit in a nighttime bombing raid.
It was quite exciting, actually. Frida woke me up and there was kind of rumbling going on and I said to her, "Don't worry, Free, go back to bed, it's just thunder." As we were drifting off again, stepmama came in and we found that our windows had been blown out and part of the ceiling had come down. So we put on our slippers and walked on this broken glass and watched the bombing, which was wonderful. It looked as if the whole of Bath was on fire. Well, the next day, my father, he said that he didn't want us to think that war was fun. And he was horrified, really, that we'd had such a grand time, and it had been very dangerous, really, for us to stay upstairs. No cars were allowed in the city. So we walked down the hill, which was only about a mile, not very long, and my father pointed out a house that was just rubble, and people were trying to get through the rubble and rescue anyone who was there. But it was pretty obvious if these people hadn't gone down to the basement, they would be dead for sure. So it was sobering.
Charles joined the army hoping to be trained as a surgeon, but was instead shipped off to India.
He didn't have to join up, but he was hopeful that they would finance him to be a surgeon. Unfortunately, that didn't happen. So instead of going to the European part of the war, he was sent by a troop ship to India.
With Charles away, his second wife Barbara beat Dorothy's children, especially the youngest, Frida.
Well, there was no protection, from stepmama, who seemed to like beating us up, and especially Frida. It was incredibly hard on Frida. She was dreadful.
Helen and Frida were relieved when they were sent away to boarding school.
It kind of saved her life. She was the kid who cried when it was time to go home and very happy to go back to school. So she went from the age of 6. Poor kid.
After the war, Helen joined her father on house calls in Cornwall and got hooked on medicine as a career.
When he made house calls, everyone knew that what he would just need is some soap and water and a clean towel. I would wait in the car till he'd seen the patient, and if the patient was well enough and wanted to see me, I was invited into the house. And I would be offered lardy cake, which they always had a slice of, and I would drink some delicious drink or milk and be made a fuss of. The fact that he was making people feel better, even if it wasn't making them live longer, but they were very confident in him that he was there behind them, helping as best he could.
Helen studied medicine at St. George's Hospital in London. She started out as a nurse.
I was the only one from the country. The lectures and so on were very good. It was 6 weeks before we were allowed to go on the wards. We were on split shifts, they were called. That was one way of doing it, where you got to the ward about 7:30 in the morning, and then you were let go again about noon for 2 hours, and then you worked until 8 o'clock at night. We had beautiful wood fires, coal fires rather, at each end of the big wards, and that was the heating. They were always selling chestnuts in Knightsbridge, and we'd buy some on the way to work. And we had booze on the ward, and we'd make punch, and we'd pour in all this booze from pharmacy and make a lovely punch, and that's how bad we were.
Helen met her future husband, medical student Peter Hays, at a party on the wards.
He was at one of the youth parties, and he was the center of attention because he was always told the best stories and had everybody in fits of laughter. I don't think we talked to each other, but we looked at each other, and he said to himself, I'm going to marry her one day, because I had a black sweater on. It was very, very fashionable. Boobs were very important to the males around.
When Helen and Peter were engaged, he had to meet her family on the other side of the city.
When we got there, they were playing bridge. And so, one by one, they would leave the game for a bit and come and meet Peter, shook hands with him, and went back to the bridge. It was really, the whole thing was ludicrous. We had the wedding at the city of Westminster, which you can't do now. You can't get married there. But all the film stars and so on used to, they'd be staying in a hotel or something. And so they had some pretty grand weddings.
In 1959, Russia was just opening up to foreign tourists after Stalin's death.
We took a Russian boat to Denmark and Sweden and Finland, and finally to St. Petersburg.
LSD was gaining popularity as an antipsychotic drug. Peter the psychiatrist dropped acid on the voyage.
They were exploring the use of LSD because it made people go somewhere else, have a trip of some kind. And he'd actually given me some, but he'd given a very low dose. And all I thought, he kept saying, what are you seeing? What are you seeing? And I said, well, the buses do look very red. And that's all I could say about it. And so he took some on the boat. I don't know how much. After he'd taken it, he told me. And then he started playing games with me. We'd meet on one deck, and then he'd disappear. And I'd be scooting around, going into all the little bars all around the place, because there's plenty of bars selling only vodka, actually. And it took about an hour before he fessed up. And I made him lie down and have a sleep.
When the couple went swimming in the Moscow River, they met a young Russian man named Edward.
There was a beach, beautiful beach, where people were swimming. They obviously didn't have bathing suits. They were just in their bras and panties, basically. It had been a ghastly war for the Russian people. We were talking, of course, in English. And this pleasant young man came over and asked us the time. And it took 2 or 3 tries before he understood what we said, because he knew English, knew it well, but he'd never spoken it.
Peter published his first novel, a bestseller called 13 Days, which made him a minor celebrity in London.
I was never any good at those parties. I didn't know how to socialize. We'd been terribly sheltered.
Helen's medical studies were cut short because Peter wanted children right away.
I was doing well in medical school, but your father wanted to have children right away. He was really, really keen on that. So in 3 months I was pregnant, and I had a really uncomfortable pregnancy altogether. I felt nauseous, couldn't drink tea or coffee or anything spicy at all. And I took the exams, but my brain wasn't functioning. Everything was a fog. So I failed the first time, which is the most awful shame I had for that, because I'd never failed anything before.
Peter and Helen were great friends with Robert and Elizabeth Harvey Kelly.
Peter and Bob Harvey Kelly were good friends in medical school, and we used to go for picnics in Richmond Park, which was beautiful.
Helen and Liz had their first children, sons Pete and James, in the same ward at St. George's just 3 days apart in the summer of 1960.
When Peter came, the first thing I did was burst into tears. And Liz the same. When Bob came to visit, she was crying too. I was producing too much milk, and she didn't have enough. So Liz and I would commiserate with each other all day.
Peter and Helen brought their new son home to a small flat in Putney.
It was nice, but it was very badly finished. The kitchen, for example, they put the sink in, and there was about an inch gap before the counter started, and it was very awkward.
Then they had a daughter, Rosie.
We didn't have a washer and dryer. I washed all the nappies and so on by hand, and there was nowhere to hang them out to dry. So there was an airing cupboard. So I would put the dripping things in the airing cupboard. Really, it was very awkward and very awful.
The family went to the Isle of Wight in the summers, and Helen loved their holidays by the sea. Bob and Liz were moving to America for Bob's new job when Liz started to become unwell.
They came back to sell their house in Twickenham and that sort of thing, and Liz wasn't well at all. They had diagnosed her with very severe metastatic cancer. They didn't know where the primary lesion was at all, but it was bleak for her, so she came and lived with us. It had a very nice guest bedroom with two beautiful beds in it. I asked her when would she like to see the children, and she swallowed and she said, "I'll tell you when I'm ready." She was meanwhile getting quite jaundiced, and James said, "Mummy, why are you so yellow?" And he remembers that. I didn't know how to answer it, so I didn't properly answer it. She said she had no pain or very little pain. She was able to get in and out of the tub by herself. I just thought that might be dangerous, but she insisted. Just a week before she died, she was really as active as she could. But it was good. If you ask almost anybody, they would like to die at home.
Liz's death would later change Helen's focus in her medical career. But first came a huge shock from New York.
On a Monday, we got the phone call from Mario Palmer that Bob had had dinner the night before and was in perfectly good spirits. He was looking forward to the new job. He was writing a letter to James, and he was dead, had been dead for hours. It must have been a cardiac arrhythmia. They're very hard to diagnose after the event.
It had been agreed with Bob that James and his sister Fleur would be taken care of by Peter and Helen, along with their 3 children, Pete, Rosie, and new baby Matthew.
The kids came back to us. We had borrowed money ahead of Grandma's money that she'd left all of us. So we bought the house mortgaged to the hilt.
5 young children meant London was suddenly too expensive.
It was a downtime, and we didn't get nearly as much money as we thought. It was about $13,000 or something.
Around the same time, Paul and his wife Liz moved to Australia, while Frida and her husband Mike took their family to the US, only to return when Mike got a new job opportunity in London.
And it was a time when you could only take so much money out of the United Kingdom. And it was so much per person. And so we included the Harvey Kellys as another family, and were able to make the jump.
The Hays Harvey Kellys moved to Edmonton, Alberta on December 5th, 1967.
Harold Jacobs, great family friend, was living in Saskatchewan, and he was recruited to go to the U of A because they were building up the medical school. Peter went over in June, I think it was, beautiful time of year, and went around the Rockies with the Jacobs family, and he had interviews in Vancouver and in Edmonton, but he very much liked the Edmonton situation. He felt that Vancouver was too fat cat and there were too many drugs and so on, and Edmonton was like a big village in those days, and the schools were good.
When Charles and his 3 brothers sold real estate in Porthlevin and gave their children a legacy, Helen bought a slice of Vancouver Island beachfront. Every summer, the family would drive over the Rocky Mountains to the coast and spend weeks at Miracle Beach. Helen resumed her studies in Edmonton. At the time, she was the oldest medical student ever admitted to the University of Alberta.
I was about 34. I thought the kids would find it bizarre that, I was part of the class and my husband was teaching them psychiatry. But there were 15 girls out of 101 in the class. I couldn't hear a word they said for the first 3 days because they were speaking with a Canadian accent. So then I got tuned in and I enjoyed it. And we had to buy a house that was big enough for all of us. Eventually we did it, which was an old historic farmhouse.
While Helen went to med school, a succession of live-in housekeepers took care of the 5 kids.
Christine, she was overweight and not getting any boyfriends. She and I cooked up a scheme. We put her on quite a strict diet that she could have as much meat as she wanted, but not have any potatoes and so on. And she lost a lot of weight and looked fantastic. So then she started having boyfriends and she started losing patience with the job with us. And one day you were feeling very unwell and you threw up. And she was very unkind to you, that she ticked you off and so on and made you clean it up. And I was so upset. It wasn't long before she was gone. I thought that was appalling behavior.
Like her father before her, Dr. Helen Hays was happy to do house calls.
Once every 6 weeks, I would go out for the weekend and be the doctor for the hospital. There was one lady who was dying of breast cancer, and she was not offered any more treatment. She'd had max treatment and they hadn't worked for her. And she said, "Would you like to see my clothes?" And so I said yes. So she took me to another room, and in the wardrobe were the clothes she wanted to be buried in. And I'd never met that before. She was glad that I thought that they were very nice, but I must say I was in shock. In England, they didn't have the open casket.
The kids were growing up. Every summer was spent at the island. Peter's mother, Doris, moved to Canada and lived with the Hays family. In her late 70s, she wed Major Horace Cave, which she described as her first happy marriage. There were jolly Christmases at home. In 1982, Helen was invited to open the first palliative care unit in Western Canada.
There weren't any interviews for that job. I was just offered it on a plate kind of thing. Your father intervened and said, "She can do this until you find somebody that really knows what they're doing."
After Peter and Helen divorced, Peter started a second family with a new son, Luke. Helen now focused entirely on her work. Her approach was revolutionary at the time.
I think that I'd always been terrified of death after my mother's death. The children in my family were not treated as if we were human beings, really, that we were pieces of wood or something. It didn't really matter. We would just skip along and get over it. So I was determined that if children were involved at all, that they should be allowed free access and so on. We had open visiting hours, and people were allowed alcohol in their rooms, and we didn't lock it up and put it away.
The Hays household was refuge to a collection of donated pets. Meanwhile, the new palliative care unit was an immediate hit.
I'd be stopped in the street and given $2 or something. Everybody wanted to support it. And it brought in a lot of money, and the administration were very happy with that. But I was a bit rebellious and didn't always do what I was told by the administration because they weren't doctors. If you ask a dying person, what they fear the most is pain. So I developed subcutaneous injections. You can drip many different kinds of medications through that. And if the patient, say, needed to have a bath in bed and be moved and rolled over and so on, they would increase the flow of the medication until they had finished their bath and then could go back to the previous level.
Helen was ordering opiates for her patients at a rate that made administrators uncomfortable.
They gave me a very hard time. And they said that I had overspent my budget. So I said, I never had a budget. You never gave me one. So they didn't like that.
Helen took her staff on tours around Alberta to encourage other doctors to focus on pain control in dying patients.
I was asked by hospitals all around, nursing homes and so on, to go and give a talk on what we did. And to the medical profession, I talked about the analgesics mainly, but the nurses would come with us and the pharmacist and so on. One neurosurgeon, very nice fellow, he's said to me that he found it very difficult when his patients were dying, especially young people. And he was very grateful for the service because we took that weight off him.
It was not an easy job.
It was exhausting. I remember 24 hours, we lost 5 patients. And you kind of can hardly move at the end of a day like that because it's so emotional, losing all these people and comforting the family.
In Christmas 1987, the family home at 8404 in Edmonton burned down. Helen replaced the house with a new one. Dr. Helen Hays changed the way terminal patients are treated in Alberta, and she was awarded the Order of Canada for her work. She now has a row of other medals.
What I was doing was putting the patient in charge, and I would tell them, when I was introduced to the patient, I would sit at a lower eye level than the patient. So it made them feel more in charge. And I would say, we work in a team here, the nurses and the other folks that you meet, but you're in charge.
Helen switched her practice to pain control. Meanwhile, a series of generous benefactors have helped Helen's 3-decade mission to open the Pilgrims Hospice in Edmonton.
It had always been in my mind that if people couldn't die at home for some reason, at least they should be somewhere, a home away from home. I think it was nearly 30 years ago, I met Marion Boyd. She and I got together and she worked incredibly hard from then on, often without any wages or anything, to keep it all together, and she's still at it now. There's a woman now who volunteers at the hospice, and she does that because I helped her as a young person when her mother was dying. And people, some people put it in their will and that sort of thing. So, they're still getting money that way. The people remembering me from way back.
Helen moved to Victoria to live with an old med school crush, Dr. Robin Barriston, until he passed away in 2014. Now Helen has retired to her favorite place, her summer home at Miracle Beach. She named her seaside home Blue Seas after her late father's Cornwall cottage. Helen is proud grandma to Connor, Henry, Greer, Liz, and Stephen. Everyone except James has now left Edmonton. In March of 2023, Helen turned 90. Back in Edmonton, they've named a neighborhood after her.
I don't think the neighborhood's been built, actually, but they've named a new suburb Hayes Ridge. And one day, I'll get James to drive me there.